Okay.
Don't clap yet. You don't know what I'm going to say. It may be like a dud. So.
All right, this is the recording.
You can clap at the end if you like it. Otherwise, just forget it.
Do you want the mic?
No, I don't like it. So this is actually a little bit of an unusual presentation for me because, and part of the reason I guess I got, do I say roped into it? I shouldn't say roped into it. But so part of what happened was that there was the golf outing. So Meriter has our annual golf outing that is a foundation event, basically looking at people in the community and businesses making contributions to behavioral health services and New Start and so forth. And I'm one of the CEOs that doesn't golf. I'm not a golf guy. So what I did was to go around in a golf cart and encourage and root on the teams. And Sue was assigned, I guess, to keep me in line, or she had some role to manage me. And so as we're on the golf course going around, she's pitching this idea, we need you to be personal, Art, we need you to give a personal story, it'll really help. And so, by the end of the 18 rounds, it felt like 36, but by the end of the 18 rounds, Sue won the point, and that's why I'm here. No. Seriously, what is unusual, though, so I'm only half kidding. What is unusual is that I wouldn't typically think or lead with a personal story or a personal example. Just partly because of my style and maybe partly because I'm not sure that it'd be, necessarily relevant or anybody would be, particularly interested. So I agreed to do it because I wanted to figure out, how to be responsive. I think I'm big on understanding and managing change. Actually, I'm so focused on it that we have a board governance conference, which is basically a board retreat once a year. We have it next week. Half of the governance, about 8 hours on Wednesday. All of the boards, the foundation, the Meriter board, the MMG board, and so forth. Half of the conference is on the care model, right? You might expect that. I've done employee forums on it. We're focused on it. The other half of the conference, 3.5 hours, is from an external speaker that is just going to talk to the board about how do you stay resilient managing change and how do you get through it. Because if you think, you can say what you want about the CEO having authority, power, decisions, whatever, but the board is the overall governance of the institution, and they are struggling with the change that comes from being now a regional board, part of a larger system, and on what that actually means and how they work through their changing roles. So I believe in it so much that I pitched to the board that we spend half the time looking at change, and that's why, honestly, it was probably not a hard sell for Sue to convince me to come to talk today and to give you a little bit of an experience. And I will tell you, always trying to be a little bit efficient. The experience that I picked, I think, is applicable to what we're going to talk about. But I also wanted to address a rumor or some of the rumors that I've heard in the hospital. And so one of my just, I guess, stylistic points is that if there is a rumor or if there's something going around, I just tend to hit it head on. And go through it, and I'll connect that dot as we talk about this. So what I'm going to talk about is in middle school, and the imposed, Laurie's like, what? That's not the presentation. But in middle school, the imposed change was every day I had to wear shoes. I couldn't go with sneakers, and I really wanted to go with sneakers every day, and that was more of an imposed change than anything I've been through in my professional career since. But no, I'm really not supposed to go there. So this is actually the last institution that I was in before I moved out west and came to Madison. And so part of the rumor that I'll connect is that I brought that institution into bankruptcy, that I bankrupt that institution, and oh my God, what is he doing here, and so forth. So that's the rumor in case you haven't heard it. I told you I was going to be just right out there, and so rumors are you deal with them and you just go right there. So I'll talk about it, but part of why I picked this picture, obviously, is because there were some really cool toys. So it was a level 2 trauma center, and we were obviously a regional player for trauma, and we really did have a helipad right outside the hospital. And thank you, Lori, for the techniques, and that was great. We really did have a helipad right outside, and it was fairly frequently used. But that's to get your attention. The real reason I'm showing you this slide is because if you really look closer and you're in the know it all about this organization, which is used to be St. Francis in Poughkeepsie, New York, that is where the real action in this institution happened. So it was part of the Sisters of St. Francis of the Newman Communities. And in fact, we did have our official convent. And that's where the sisters lived for the 100 years of this institution. It was 100 years old. And you can say what you want about the hospital and all the toys, but basically the sisters were the heart and soul of the institution, and frankly, they ruled it in many ways for many years with an iron hand. And I say that with love and respect. And actually, these were most of the sisters. By the time everything settled out, there were only about 5 or 6 there, but I had worked for this organization about 10 years before, and I lived about 3 miles down the block from this organization. And I have 4 kids, and they get into issues and troubles, and I have had many a night spent before I was part of the institution, many a night in the ED and the trauma with broken bones and a couple of surgeries and so forth. So I was well acquainted with the institution, and they were well acquainted with me because I had worked there before. So basically, my kids were getting older. I had the opportunity to relocate. I was working somewhere in Westchester, and I was just pretty open about the fact that, I enjoyed New York for the time I was there, but I was looking to relocate. I'd be leaving. I was kind of saying goodbye to the sisters, saying goodbye to the local parish that I was a part of, and the sisters basically called me into the convent. And I will tell you, it was actually fairly rare that a male was invited into the convent. And I don't have the pictures and all of that, but it was quite of an experience because they take a vow of poverty. And so the convent, the sitting area, basically the living room, was patched together from donations and Salvation Army stuff, and it was every color of furniture and every pattern, and it was actually pretty neat, actually, to see it, because they so lived their values that it was in the furniture. You could see what mattered to them. But anyway, what they did was they got me together and they said, look, Art, we've got about 58 days cash on hand. We've got some operating issues. They had some trouble with a previous legacy software package. Would you be willing to spend 6 months with us? So just tell us what you think. Tell us what you're looking at. You've got experience. You can parachute in, parachute out. And over that 6 months, you'll just help us figure out what's going on here, what we need for the longer term, and so forth. And I will tell you, when this is Sister Rosemary, and she ran the OR and supply chain for like 20 years, and when Sister Rosemary says, so, Art, will you do this for me? You basically do it. So I did that. I parachuted in and started my tenure. So I'm aging myself here, but if anybody's had kids and you've gone through, trying to help your kids, there's the old math and then the new math. So if I see blank faces, then I'll know the age cutoff of the room, because if you don't know what the new math is, then you're young and vibrant, and if you know what the new math. So anyway, the new math became, when does 58 not equal 58? So you got 58 days cash on hand. Do you really have 58 days cash? So second day into the position. The first day, actually, we were served with notice that all of the nurses were unionizing. So that was day one. Second day was a discussion with the bondholder agent. And basically, the bondholder agent, this was over the phone, they were in Massachusetts, they say, welcome aboard. I just want to explain something that I've been trying to explain to management, and they had gone through different management. I'm trying to explain this to management. The nuns really didn't get this. But, you have 58 days, except 30 belong to us, so you really only have 28. And 8 of them say in our bondholder agreement that those are reserved, so you can't touch those others. So you really have 20, except 10 are lines of credit, and the bondholder agreement says you can't use any more lines of credit because you only have 58 days, which you really don't have. And then 8 of those days we know are going to pay vendors immediately. So Art, you really have 2 days of cash on hand. Have a nice day. Welcome aboard. So that was day 2. The sisters really didn't understand what was happening with their institution. God bless them. They were, as you can see, some of them were fairly aged. They were having some physical, health issues they were struggling with, and they kind of lost touch. Not with the heart of the institution, but with the operations of the institution. And so, frankly, I was there for 2 days. I couldn't have done much to bring the organization into bankruptcy. And I had a situation where the change, if you will, was fairly imposed upon me within 2 days of my being there. And I will tell you, part of what I thought was, I'm getting out of here. I was like on my way to, somewhere else, and I was fine. And now all of a sudden I'm part of an institution that is beyond a crisis situation. I didn't sign up for this. I was just kind of doing a favor for the nuns for some period of time. I also thought a little bit about, well, we could probably make it through 6 months, so maybe I'll just ignore what I have. I'll work things, and try to do something. But I could probably just, skirt some of these major issues and not have to really take them on for 6 months and then just, kick the can to somebody else. I could accept whatever was going to come, and that was a real possibility. There were a bunch of lawyers involved. The bondholder agent was actually a lawyer. And so I could basically, whatever they're going to do, they're going to do. So go do it, and, I'll be part of it. Or I could engage. And I don't want to stand here telling you today that it was an easy decision. And I'm not telling you today that, I'm the hero because I decided to engage, because I can tell you I really thought about all of those options, especially on day 3, the cutting and running. So this was a really difficult decision, and I really struggled with it. And I say the word, and I hope you're recognizing it. It was a decision. So the circumstances weren't a decision. They were what they were going to be. And I had, especially at that point, I had almost no control, certainly very little control over it. It didn't matter that I was the CEO of the organization. There were no levers left, or very few levers left to pull. So in fact, I was faced with a series of circumstances that I had to make a choice about. And I will tell you personally what I did and what I tend to do, especially in situations like that. And I offer this only as a personal strategy. You'll have to figure out what your strategy is or how you deal with it. And some of this relates specifically to personal, or I should say professional work kind of decisions. And some of it, for me, just relates more broadly to how you deal with change and issues, even on a personal sphere. So one is I needed to seek support and some nurturing. I was in a pretty difficult decision-making situation. There was a lot of anxiety. I didn't know what I wanted to do, and I needed to make that decision. I needed to make it probably fairly quickly. And so I sought support from children, my kids, significant other friends that were in healthcare, a fellow CEO that I knew, and so forth. And not surprisingly, there was a varying level of response. The other CEOs, like, get the hell out of there as fast as you can. You don't want to be tainted with this. You don't want to be part of it. Just walk out now. And depending upon if it was a more personal contact, they knew that I was going to have to struggle with this a little more, because if I just walked away and I really kind of abandoned the sisters and this organization, that I was probably going to struggle on the other side with what did I do, and could I live with myself with that. So depending upon who you ask, and it's what I tell my kids, be careful, the people you hang out with are partly who you become. And so depending upon who I asked, I got slightly different advice. And then I had to really step back and say, professionally, do I really believe in this? Do I really believe that this organization can and should survive? Maybe it should close. And maybe I should take a step back and say, what can I get behind? Because, when it gets really dark, right, at night, or when it gets really lonely, or when you're really struggling, if you can't believe in it, if you can't kind of bootstrap yourself to get to the next step or to take the next step, then it's really that much harder. So you've got to really, I had to decide, do I believe whatever I'm going to do, if I'm going to try to save the organization or do something different, do I really believe in it? Or am I just going through the motions? I also had to figure out, okay, so if I'm here for more than the 6 months now, can I really work with who's left? I will tell you, within 2 weeks of coming on board, we had a parent organization. The parent organization wiped out the existing board. And those that were friends with some of the people that were wiped out resigned, because they felt that they shouldn't have been wiped out, even though the organization was in this kind of state. So I had to figure out who am I working with here, and can I work with them? It's very, as all of you probably experience or know, your work team, your environment, your organization make a big difference in terms of how not only you get up every day and go to work, but when the time gets rough, when there are patients, buzzing all around, or family members that are, issues, if your fellow worker has got your back and you feel part of a team, that makes a really big difference in terms of the ability to do that. And I had to look around. And the interesting story, it was a faith-based institution, obviously. It was St. Francis. I'm Roman Catholic. The chair that stepped up, the only person that was willing to step up and be the chair of this organization, was actually an Orthodox Jew who was on the board. And between him and the senior team, some of which really stayed and wanted to work for this institution to do whatever needed to be done, I looked around and I said, wow, I can work with these people. I really can. It's not going to be easy. And I can tell you, there was a lot of angst, some crying, and raised voices throughout the year and a half that I was there. But every Friday, we would actually get together in my office, typically around 3-4 o'clock, and we would just start talking about things. And sometimes it'd be work-related, and sometimes it wouldn't. But I can tell you, by the end of it, people were laughing, and they almost didn't want to go home. Now they did, right? And it was Friday, they want to go home. But they stayed in that office and really and it was very informal. People put their feet up. But we had really gelled as a team, and that made a big difference, and that happened fairly quickly. For me, in that situation, I was talking about choices, like I just mentioned, and I did have to make a decision. One of the things that I guess I'm trying to say, and I've said this actually through some of the employee forums, is anytime there's change, you are really making a decision. And whether you recognize you're making a decision or not actually probably goes a long way in terms of whether you have the ability and the coping skills and the resiliency to be able to deal with change. Because you need to be recognizing that at the end of the day, you have a decision to make, even if the decision is just how you're going to respond to the change. And the other thing, and I learned this in my life in general, and maybe you have too, or maybe not, but I'm being personal here, so I'll tell you it factored into this decision. If I was figuring out whether I was going to stay, for the 2 weeks, okay, I'll stay for a week, no, then I'll stay for 2 weeks, I would have actually probably gone insane if I constantly revisited that. So I'm not saying that any of us or I don't reevaluate on a regular basis. But again, I don't know, you have to take this as you will, but personally, the greatest angst typically comes when I'm trying to decide. Actually, when you get on the other end of the decision, whether it's to stay or go or engage or ignore, it actually tends to be a relief. It doesn't mean it's not hard work. It doesn't mean that it's not maybe the hardest work, but there's a certain settled feeling about knowing that you've chosen and you have a course. And the question comes, can you, and that's part of the litmus test for me, could I say, okay, I may be here a year? Could I make that choice and not every week say, I don't know if I'm coming back on Monday. I just don't know if I'm going to think about it all weekend, whether I'm coming back on Monday. And some of it is a leap of faith. And again, I'm not trying to tell you here, you make a leap of faith, you're here for the next 10 years and you don't think about it again. But what I am saying is that the opposite end is probably even more destructive for a person and the organization or a family or whatever. You got to make a decision, you got to commit, and then you reevaluate that commitment at whatever appropriate time. But if you're constantly doing it, you're going to be a mess, or at least I would be a mess. So for that institution, bankruptcy for St. Francis, it was the right decision at that time in those circumstances. I didn't create it. I didn't bankrupt my last institution. But I did, however, make ultimately a decision that the institution was the only institution in the area that provided level 2 trauma. It had 100 behavioral health beds that nobody else wanted, and we were a regional player. We had the only psychiatric emergency room in a 3-county area. And I had made a calculation that I agreed with the sisters that if nothing else, those things had to remain, even if we gave up a lot of other things. And that in fact, it was worth trying to preserve those 1,800 jobs and those services. So I started to, answer my own questions. I sought support, and I knew that my family and this group of professionals that I was going to interact with throughout this process were going to be able to support me. And I had that reservoir when times were really going to get tough. And I will tell you, times got really tough, really tough. Went to the State Department of Health and said, we've got 100 behavioral health beds, we've got trauma, the institution, whatever happened, we need some help, we need some breathing room. State of New York at that period of time had 20 hospitals throughout the state saying the same thing. Basically, I went up there with my board chair that was newly elected. We drove an hour and a half to the Capitol in Albany. We sat down. We said, this is a no-brainer, 100 behavioral health beds. We're not asking forever, but we need some money to get us through. And they said, can you put together a closure plan within the next 3 weeks, please? Because you're not getting a dollar from us, because everybody in the state's asking for money. And if you close, you close. And they washed their hands of the situation. So I'm not telling you that this was easy or that this was not something that I was continually, and I had to continually seek that nurturing and support. But I also got behind it. I really believed in it. I mean, I could sell it to the community, to politicians, ultimately to the courts and to professionals. We had very little turnover, believe it or not, in terms of medical staff. Employees, by and large, stayed with the institution. We had a lot of forums. We had a blog going. We had a lot of transparency. But I could do it because I believed in it. I really believed in what we were doing and that it was the right thing. I liked the people that I worked with. That leadership team was great. They pulled together. We all took 10% pay cuts within the first 2 weeks. And that didn't, I won't say it didn't matter. There was a lot of animated discussion about it. But they stuck. They stuck with that institution. And I recognized that I was making a choice. I was absolutely making a choice. And again, I'm trying to present this as honestly as I can, but a lot of the imposed change, if you will, these were circumstances that were happening. I wasn't going to be able to reverse all of this. I wasn't going to be able to say, no, we're not going to do that. And when you get into this kind of situation where you get courts and banks and bondholders involved, your degrees of freedom is like this, because it is a very formal process. So throughout this, much of the change was imposed. And it was really how we responded and how we were able to work around the edges and how we were able to not fall apart as an institution, really that made all the difference. I just contrast that with here because we're not in crisis here, okay? And that's not why I was brought here. It's solid footing. It's individually you've been strong. We're now part of a $4 billion organization. But I will tell you there are some similarities, right? And the similarities are not that we're in crisis, but in some ways a crisis is almost easier because at some level people recognize they're in crisis. So what I'm asking Meriter to do is say you're not in crisis and we don't want to be in crisis, but that means we really need to engage. And that means we need to change well before you ever get there. Because you can't, nothing can stay the same, and especially in a market like this, in an environment like this. So, have you heard the story of the boiling frog? Everybody knows this one? No? Okay. So the question is, I know it's a little sick, I guess, but how do you boil a frog, right? If you take a frog and you take a pot of boiling water, and you just drop the frog in, that frog is going to go for the side and he's going to jump out and you're not going to, unless you hold him down, you're not going to have boiled that frog. So what you do, the way you boil a frog, the parable, is you put the frog in lukewarm water and you ever so slowly turn up the heat. And so it just goes up a degree an hour, a degree every 2 hours, whatever it is. And the frog doesn't react because it's a very slow change. But at some point, you hit that tipping energy, and all of a sudden, the water begins to boil and the frog is done. And that's where I say sometimes in a crisis, it's easier to recognize, oh, it's a crisis. All hands on deck and we're going for it. We're not in a crisis, and so that's a good thing, right? That means there are a lot of levers that we can pull right now in order to really engage and navigate our path. But it also means that it is slightly harder to have people engage in a change. Because if we're doing okay, then why do we need to change? And that's why some of that is, frankly, it's the same reactions and the techniques, I would argue, for me and for others, that you think about in a crisis that you would think about in, why we're changing EPIC, except one is a true crisis. I mean, that's a situation where the entire institution can close, and here we're making a change to better patient care and to be part of a $4 billion system. So you can view it however you want, but you're making a choice on how you view it. And that's something that we each need to own, that in fact some of these are we're making choices. And so I guess that's my question to you. I told you the choice that I made in that particular situation. I had to engage because I really believed in it in the end, and that was the only way to move it forward. Meriter is changing. We're becoming part of a health system. We've talked about the EPIC to death. We're going to the care model. Where mission and vision is being revised. I mean, change upon change, right? It's accelerated. So I just want to make sure that each of you in the room perhaps has a lens to say, so what are you going to do? Right? Because each of you has a choice. We can talk about the institution, we can talk about the organization, but I've said this before, and I think most of you know I did direct care provision early in my career. I'm a social worker. At the end of the day, an organization doesn't take care of a patient. Individuals do. You take care of patients. So what are you going to choose to do? I mean, are you going to run as far and fast as possible? You could choose to do that, and that's a legitimate choice. I would argue you're going to have to run pretty fast and pretty far because UW is merging. Dean is trying to get the money that or St. Mary's is trying to get the money that SSMA is trying to get the money they paid out of to Dean, and so they're trying to consolidate. I mean, you're not going to find a safe place in healthcare, and when I say safe, meaning complacent. It's change right now. So I would actually argue that it's the organization that's not transforming and changing. That's where I would really be worried. Because they're really not, they're that frog, and it's starting to get hot, and they're just not recognizing it. Are you going to ignore or resist? I mean, that works maybe for a while, but I will tell you, it probably tears up the organization as much as it tears you up individually. I mean, just, at least in my experience. You start doing that, you start having a disconnect between what you are as a professional and how you're behaving in an organization. And for most people, that's just a terrible disconnect because most people, especially in the healing professions, that's not who we are. And so you try to resist and it just doesn't feel good. It just doesn't feel good. You can do the float on the wind strategy. I'm gonna go along with it. I'm just gonna do whatever the wind tells me. I'll do what I'm told. I get it, and that's maybe an acceptable strategy. And depending upon where you are in your career or where you are in terms of your professional development, maybe that works. And if you're taking really good care of patients and appropriate with others in the institution, it works. And then there's those that hopefully are going to say, you know what, I'm beginning to understand it. I buy into it. I don't just understand it, but I buy into it. I can make a choice to engage. I can make a choice to model this for others or to really make it happen. Because I have sought support from those that I respect, from fellow nurses or fellow clinicians or whatever. Because I can say to myself, I do believe. I believe this is a better way to take care of patients, to focus on the care model, to focus on the continuum, to focus on access and transparency. I can say that's a better way. And where you work and who you work with, you have to decide, is the unit, is the area, is the organization, is it an okay place to work? And, not only do you get nurturing when you get home from your family, but can you get recharged a little bit in the institution by interacting with your fellow providers? The first three, you're going to have to answer for yourself. What I would challenge you today to leave recognizing is that whatever you do, you're making a decision. To pretend like I'm not going to decide, no, you really decided, then you're floating on the wind if you're not going to decide. So I would argue, and my challenge to you is to decide, is to think about whether you agree that in fact you're making a decision relative to all of the change. And that, again, I think they wanted me to talk because, the CEO just came from a situation where I didn't really have a lot of choices except for the ones I outlined in terms of what I was going to do, how I was going to react. And of course, the choice we all have, right, in organization is we could leave if we really don't believe in it. And then I would say to you, if you agree that you're making a choice, make a choice, but try not to revisit it every day, because I think you're just going to tear yourself apart. And that means that it's not going to go great every day, right? There are going to be issues. And September 13th, I'll be here with you 24/7, but it's not, things are going to happen. I'm going to be going around the floors. You're going to be there. Things are going to happen. And, you've got to make a choice today and then, maybe a week after to say, I know things are going to happen, but I'm not making that kind of choice every day because that would tear me apart. So, this is where I end and say I challenge you then. Our strategy is clear. I've told you what our strategy is. This is it. We're delivering value by coordinating care across different providers now, by building or buying or partnering, right? We're not building everything ourselves, and we're creating the regional clinical enterprise. We're in discussions with long-term care providers, with other providers, with UW, everything I've told you already. That's the strategy. I'm not going to go into it right here, but I do think it is better for this organization. I think it's better for the community, and I think it's better for patients and their families. I really believe that. I'm behind it, not because somebody told me I had to be behind it, because I really do believe it. Frankly, that's part of what drew me to this organization in UnityPoint Health. But our strategy is not our identity. We're still going to be the community hospital. We're going to have to promote that as value and behavior and culture. And so this is it. This is what I'm asking you to choose to be part of. And ultimately, how you choose to be part of it, or if you decide to leave, that's ultimately going to be your decision, because we can talk about imposed change all we want. In fact, control is an illusion at any level, including my level. It's just an illusion. And if you kind of accept that and realize that the best you can do is try to influence and be authentic and get behind something and make a choice about how you're going to respond to the vagaries of the world, or maybe an organization, I think then you begin to just have a different worldview on things. So that's my story, and I'm sticking to it. All right, so I'm going to Lori now.
Me. I'm in. Are you in? I'm in.
And I don't have